Welcome to the first part of our two-part Getting to Know Dementia series. In this presentation, we will take a look at just what is dementia. This presentation is for anyone affected by dementia, so whether you are living with it yourself or supporting someone who is. The material presented is honest and upfront about what is happening in the brain and what to expect in terms of progression. And so there might be people listening today who have recently been diagnosed or are in the process of being diagnosed. And this certainly can be a very sensitive and emotional time. Some of the information may not be applicable to your current situation, but it may become more relevant in the future as the disease progresses. And so if you find that the information is upsetting or even alarming to you at first, I would really like to encourage you to follow up with someone about what you do here today and about any of your questions you may have by calling our first link, Dementia Helpline, at 1-800-936-6033. So what are we going to cover today? We'll talk about what dementia is and the diseases that cause dementia. And we'll be sure to include one of the top questions we get asked at the Society. What is the difference between Alzheimer's disease and dementia? You'll learn about some of the physiological changes that occur in the brain, as well as the different stages of dementia and what we might expect as the disease progresses. We'll also take some time to talk about some of the myths that you may have heard about dementia, and then we'll briefly touch at the end on medications. As you listen to this presentation, there are three things I'd like you to keep in mind. Firstly, if you have met one person with dementia, you have truly met one person with dementia. That means that everyone experiences dementia differently. Secondly, if you have met one family living with dementia, you have met one family living with dementia. So spouses, adult children, siblings, and even in some cases, parents can become caregivers. And we all have different relationships, our family dynamics, our values and beliefs, our coping styles, and all of this will shape our experiences of caregiving and living with dementia. And there's often no right or wrong when it comes to learning to live with dementia. So while we can certainly learn from each other through participating in caregiver support groups or early stage support groups, attending education, attending webinars, it is so important to realize that what works for one person may not necessarily work for another. And then finally, dementia affects many different people across all cultures, young and old. While most people, yes, they are over 65 when they're diagnosed, there are also people who are diagnosed with young onset dementia. And this means that they are under the age of 65 years when they are diagnosed. Let's start by looking at the question at the top of the slide. What is dementia? Dementia is a broad medical term or an umbrella term that we use to describe a collection of symptoms that indicate physiological damage in the brain. What kind of symptoms are we talking about? While, yes, these may include memory loss, it's so important to note that dementia is much more than just memory loss. Other symptoms are difficulties with thinking, problem solving, or language, and the combination of these symptoms is severe enough to reduce a person's ability to perform everyday activities. In addition, changes in mood or behavior are also common. Unfortunately, dementia is progressive, which means that the symptoms will get worse over time as more brain cells become damaged and eventually die. Here is a stat that might surprise you. It is estimated that about 70,000 people in British Columbia are living with dementia, and the numbers of individuals impacted will unfortunately continue to rise. However, if you are one of those people, we want you to know that you and your family members are not alone. Under the umbrella of dementia, there are many specific diseases that cause symptoms of dementia. They include more than 100 different kinds of dementias, including Alzheimer's disease, vascular dementia, mixed dementia. So that's when the person has more than one disease causing the dementia. A common combination there is Alzheimer's and vascular dementia. Dementia with Lewy bodies, frontotemporal disorders, and this is a group of rare disorders that primarily affect the frontal and temporal lobes of the brain. And then there's simply the diagnosis of dementia, with no specific diagnosis is made as to what disease is actually causing the dementia. And increasingly people are being diagnosed with neurocognitive disorder when no specific disease has been identified. We will talk a little more about these different diseases later on in the presentation. So even though there are many different diseases that cause dementia, and each person who has dementia is different, as we mentioned earlier, what they all have in common is dementia. One way to look at the difference between dementia and Alzheimer's disease is to think of the word dementia like the word fruit. So up on your screen is a fruit basket full of fruit. Fruit is an umbrella term, but there are many types of fruit. In the basket, there's apples, nectarines, bananas, and grapes. So if I have a banana, I have a piece of fruit. But if I have a piece of fruit, it doesn't necessarily mean that I have a banana. This is similar to dementia. If a person has dementia, it doesn't necessarily mean that they have Alzheimer's disease. Instead, they might have one of the other dementias, as we discussed earlier on. They may have vascular dementia or frontotemporal disorders, Lewy body, or another type of dementia that is causing their symptoms. Alzheimer's disease is thought to be the most common form of dementia, and that is one reason why you often hear the term being used interchangeably. The diagram on your screen now is more a sequential way of demonstrating how the various diseases are related to the term dementia. So first of all, we have the progressive degenerative diseases, which we described earlier on, which cause destructive protein and vascular changes in and around the brain cells. This causes damage to brain cells and neural pathways in the brain. And this leads to symptoms of dementia, such as the memory loss, the confusion and disorientation, impaired judgment, communication problems, behavioral changes, and others. So let's dig into some of the physiological changes related to the various forms of dementia. Healthy human brains have billions of brain cells called neurons, and these communicate with each other through neural pathways. This works like long arms and legs that reach out to each other to pass signals back and forth. Everything we think, say, and do is a product of our brain cells communicating with each other. So how does Alzheimer's disease impact the brain? With Alzheimer's disease, the brain cells are no longer able to communicate with each other because of abnormal deposits of amyloid beta protein, which clump together and over time become amyloid plaques. So these plaques build up between the cells, which causes a barrier in communication pathways. So it's kind of like hitting a detour when you're driving and you have to travel an alternative route because the one you plan to take is no longer available to you. Now, the other protein involved in Alzheimer's disease is called tau. When tau protein malfunctions, it causes the scaffolding or the structure of the cell to collapse, which then causes tangles to form inside the cell. And unfortunately, when this happens, neurons lose their ability to function and they eventually die. So in this case, the roadway for communication between the cells has crumbled and can no longer be used. Next, we'll take a look at vascular dementia. Our vascular system is made up of a network of blood vessels that supplies the brain with oxygen. Vascular dementia happens if there is a blockage in the vascular system or if it is diseased, thereby preventing blood from reaching the brain. It's kind of like a plant that doesn't get enough water. The brain cells eventually shrink and die because the important oxygen, nutrients, and glucose that are transported through our blood are cut off from the cells. While many today may be familiar with Alzheimer's and vascular dementia, you may not be as familiar with dementia with Lewy bodies. What are Lewy bodies? Well, they are another kind of abnormal protein deposits that build up inside the brain cell and interrupt the brain's messages. It's still unknown why or how Lewy bodies form in the brain, but like with Alzheimer's disease, the abnormal proteins will cause the brain cells to stop working properly and eventually cause the brain cell to shrink and die, once again causing a disruption in those very important neural pathways. Dementia with Lewy bodies usually affects the areas of the brain that involve both thinking and movement. So tremors and feet shuffling, for example, are typically more prominent. If cognitive symptoms appear at the same time as, or at least a year before movement problems, the diagnosis is dementia with Lewy bodies. However, if cognitive problems develop more than a year after the onset of movement problems, the diagnosis is Parkinson's disease dementia. Next, we'll look at frontotemporal disorders, which is another type of dementia. Unlike Alzheimer's disease, which generally affects most areas of the brain, frontotemporal disorders primarily impact the frontal and temporal lobes of the brain. Atrophy or shrinkage in these areas of the brain can result in profound changes in social behavior and personality. And so inappropriate language and behaviors are common. Someone may appear apathetic and uninterested. They may have difficulty focusing or maintaining their concentration, and they may stop hobbies or other activities that they previously enjoyed and did on a regular basis. Memory loss here is less prevalent with frontotemporal disorders. Up on your slide now is an image of the limbic system. The limbic system is sometimes referred to as our emotional brain because it helps us generate emotions, while the cortex or thinking brain helps us think about and respond to our emotions. The limbic system links the lobes of the brain, enabling our whole brain to connect behavior with memories and embedding emotions and memories together. This part of the brain is affected early in Alzheimer's disease and in some of the other dementias. And damage here may result in an increase in emotions like suspiciousness, irritability, depression, or anxiety. Now, a crucial part of the limbic system is the hippocampi. The hippocampi, there is one hippocampus on each side of our brain. They are the major short-term memory processing centers of the brain. That's where verbal and visual memories are processed and stored into long-term memory. Verbal memories are words or memories related to what we read or say or hear, whereas visual memories let us recognize objects and faces and places in order to guide us around our environment. Now, when this part of the brain is damaged, things don't get written into long-term memory, which means that they simply cannot be recalled later. Damage here may also change a person's ability to recognize familiar faces, objects, or places, and can result in someone having difficulty finding things. Here's one example of what can happen when changes to the limbic system take place. So Linda and George hosted a family dinner last night. Linda made the dessert, a recipe for which she is famous for in social groups. There was great conversation and lots of laughter, and at the end of the evening, Linda seemed in great spirits. She absolutely loved to see the joy it brought her eldest grandson, who always proudly exclaims how it is his favorite dessert. Now, the next morning, Linda commented to George about how long it had been since the family had gotten together, stating that she hadn't seen her grandkids in ages. In that moment, Linda had no recollection of hosting the family dinner or even making her favorite dish. That evening had simply not been written into her long-term memory. Thankfully, George knew that no matter how much he wanted her to remember, he could not change the fact that her brain had not retained that information. So he held back from saying, "Don't you remember? The kids were here last night." And instead he agreed with Linda that he missed the grandkids too, and reassured her that they would plan a family get-together soon. Even though Linda did not remember the wonderful time she had, George knew that it was a meaningful experience for them both. It is important for Linda to remain social, and because her signature dish is something she still feels confident preparing, it gave her a meaningful way to contribute to the evening. So while there are several different diseases that cause dementia, as we've mentioned, the Alzheimer's disease and vascular, Lewy body, etc., most eventually become quite similar in their symptoms, and they do lead to pronounced shrinking of the brain or atrophy. This image now that you see demonstrates what the brain of someone with very advanced Alzheimer's disease would look like. Although this is not a very pleasant image to look at or discuss, it is important that we understand and recognize that there is a real disease happening inside the person's brain that is causing their symptoms. Oftentimes, a person with dementia can look quite healthy or like nothing is wrong on the outside, which makes it difficult for caregivers and family members and friends to sometimes make sense of their symptoms. And in fact, we often hear from people living with dementia that this is one of the most difficult reactions that they receive. "What do you mean you have dementia? You look fine." So this image can help us work through that by reminding us that their brain is changing. It's changing in size, in weight, and in volume, and they are not in control of their symptoms. And the normal pathways of communications between brain cells have permanently changed. They are not doing the things they are doing on purpose. As we mentioned in the beginning of our presentation, dementia is unfortunately a progressive disease. So in the next part of our presentation, we will take a look at this progression. It can be helpful to talk about the progression of dementia in stages, as this can give us a better understanding of the illness. Some healthcare professionals use the Global Deterioration Scale, also called Reisberg Scale, to measure the progression of dementia. So take a look at the slide on your screen at the moment. This scale has 7 stages of ability, starting with no cognitive decline at all, which would put all of us on the scale somewhere. However, the more widely used model is the 3-stage model, where changes are referenced as either early, middle, or late stage, or perhaps you've heard it referred to as mild, moderate, and severe dementia. As I mentioned earlier, these scales give us a better understanding of the disease, and they also allow us to feel more confident asking questions if a healthcare provider says something about a stage of dementia to us. For today, we are going to look a bit more at the symptoms of progression through the lens of the three-stage model. So as I go through these symptoms, keep the earlier images of the brain in mind, particularly the image showing the deterioration of the brain. While that was a picture of a very advanced Alzheimer's disease brain, it can help to remind us that even in the early stages, the symptoms are related to physical changes in the brain and are not within the control of the person experiencing the changes. So as we go through these stages, we'll look at changes in 4 areas. Up on your screen now, you'll see those 4 are mental, emotional, behavioral, and physical abilities. In the early stages of dementia, changes are already beyond what we would consider normal age-related memory decline, and symptoms are beginning to make an impact on the person's daily life. These are common symptoms, and as I've said before though, each individual with dementia will be different and not necessarily experience every common symptom. So in the early stages, changes in mental abilities can include mild forgetfulness. So although it's normal to occasionally forget appointments or neighbors' names or a friend's phone number and then remember them later, a person living with dementia may forget things more often and not remember them later, especially things that have happened more recently. So for example, like Linda forgetting that she hosted a family gathering the night before. Changes can include misplacing objects, having a limited attention span, and difficulty learning new things. There might be some communication difficulties, such as finding that right word. And while we all have trouble finding the right word sometime, you know when you have something right on the tip of your tongue. We call it that tip of the tongue moment, which is frustrating for us. But a person living with dementia may forget simple words, or they may substitute words, which can make their sentences very difficult to understand. There might be difficulty following conversations, especially when someone is talking quickly or there are multiple people talking at the same time. And there may start to be problems with orientation or getting lost on familiar routes. Let's look at emotional. So we'll see moods may start to shift easily, and you may also notice a loss of interest in social activities. So the person with dementia may initiate activity less often, but generally they will still be interested in participating when they get there. And we have heard from some people living with dementia that they feel that they really get judged as being lazy. But it is particularly important here to understand that this change is likely because of a deterioration of the part of the brain, which is actually the frontal lobe, and that is where the area that switches us on and allows us to activate ourselves. You may also notice signs of depression at this stage. If we look at behavior, you might see passiveness, withdrawal, and restlessness. Physically, you might begin to notice mild coordination problems like stumbling more often. In the middle stages of dementia, people commonly experience the following symptoms. So mentally, you may see continued and intensified memory problems, problems with abstract thinking. So this is like making sense of symbols and images, or not understanding metaphors, such as it's raining cats and dogs outside. There's also often an increase in language difficulties at this stage and a potential inability to not recognize some family and friends. You may notice an increase in visual spatial problems or disorientation of time and place. So while it is normal to forget the day of the week or your destination for a moment, At this stage, you may see someone living with dementia become lost in their own condo complex and find themselves walking into someone else's apartment. Emotional changes. Here you may notice an increase in anxiety, suspicion, anger, sadness and depression, hostility, apprehensiveness, and general shifts in mood or changes in personality. Some people may become more docile, while others may become more assertive than those around them are used to. You may also notice a decrease in initiating social activities. So for example, Linda used to love going to bingo several times a week, but now she refuses to go. She fails to initiate contact with any of her friends, and even when she gets invitations, she declines. Changes in behavior. You may see a declining ability to concentrate and an increase in restlessness, such as pacing and wandering. Repetition, like asking the same question multiple times or doing repetitive things, re-washing dishes that have already been washed. You may also start to see an increase in delusions, aggression, passiveness, and uninhibited behaviors, which means that those social filters that we use to tell us how to behave appropriately in a setting start to come down. And we may say or do things that are not appropriate for the social setting and out of character for us. Again, do keep in mind though that not everyone may experience all of these symptoms. Physical changes. Here you will notice that you will require more assistance with daily tasks. So these tasks are dressing, bathing, toileting. You may notice an fluctuation in appetite, either reduced or increased, and sleep patterns often become disrupted. They either require more sleep or they're waking up at night more often. We are now going to talk about the symptoms of the late stages of dementia. I want to note that this might be difficult for some of you to listen to, and you may not feel ready to hear this just yet. So please feel free to skip this slide. If you would like to revisit this information another time, you can always call the First Link Dementia Helpline or look at the resources on our website. So by the late stages of dementia, the brain has become significantly impacted and the changes are much more severe. Let's look at changes mentally. Here there is likely to be both short and long-term memory loss, as well as a marked decrease in the ability to process information. There is a much more severe impairment in communication, with often speech being very limited or even non-existent. There may also be a severe disorientation about time, places, and people. So for example, returning to Linda as our example, she's no longer able to distinguish the difference between a 10-minute visit and a 3-hour visit. And often after just a very short visit with George, she simply turns away and goes to sleep. Someone in the late stages of dementia is likely to have a profound difficulty expressing emotions. Look at behavior changes. This becomes a more critical form of non-verbal communication. So when they can no longer communicate verbally, often behavior is a way of expressing pain or unmet needs. Then physically, a person will sleep longer and more often, and they may be unable to walk independently or at all. There may be weight loss associated with difficulty eating or swallowing. There is usually a loss of ability to speak, to dress and bathe, and a loss of bladder and bowel control. Now, it is important to keep in mind that these scales represent a general description of patterns. Again, they are not specific to individuals. And remember, at the beginning of the presentation, I asked you to keep 3 things in mind. The first being, if you have met one person with dementia, you have met one individual with dementia. So those scales are general. Also, symptoms can differ from one person to the next, and individuals may not move precisely through these stages. Some early stage symptoms can begin in mid stages for some people, or for some individuals, a typical mid stage symptom may appear in early stages. It really does depend on where the protein deposits or the vascular changes are that are causing damage to the brain. And the decline might look different depending on the exact form of dementia. It's common for people with dementia with Lewy bodies to have fluctuations in their cognition. People, though, with Alzheimer's disease tend to decline slowly and steadily, whereas with vascular dementia, the decline can be more stepwise, depending on how often and where the strokes occur in the brain. So again, this just shows that stages are not exact. It's also not possible to estimate the time it will take to move through the stages or the life expectancy of someone who is diagnosed, since it varies so widely from person to person. There are many factors that affect progression. These include other medical conditions that the person is living with at the same time as the dementia. It's also been well established in research that the protein changes that cause Alzheimer's disease in particular can actually start to form about 15 to 30 years before the onset of symptoms. So it's impossible to know precisely how long the individual has had the disease before they received a diagnosis. Okay, so we have heard some things about dementia that may have us scratching our heads, wondering if it's actually true or if it's just a myth. So just take a few seconds to think about some of the things that you have heard about dementia that you think might not be true. All right, so dementia is not strictly genetic. Genetics is often a question that comes up around Alzheimer's disease. Familial Alzheimer's disease, or sometimes referred to as autosomal dominant Alzheimer's disease, is genetic, but this accounts for less than 5% of all cases diagnosed. This gene tends to cause young onset Alzheimer's disease, primarily diagnosed between the ages of 50 and 60. Sometimes people are concerned about a family history of Alzheimer's disease, when in fact they have a family history of dementia due to different causes, like cardiovascular disease, diabetes, or hypertension. So this is why reducing our risk of these diseases also decreases our overall risk of developing dementia. But overall, the vast majority of people with Alzheimer's disease are diagnosed with sporadic Alzheimer's disease, which means that there is no direct identifiable cause. Dementia is not a natural part of aging. I'll often hear people say, well, everyone gets dementia if you live long enough. But actually, that's just not true. Although age, yes, is the most significant risk factor for developing dementia, it's not natural to develop dementia as we get older. Dementia is caused by disease that damages the brain. While age does increase the risk of dementia, as it does our risk of developing certain cancers or osteoporosis, arthritis, and so on, many people will live to be very old with no sign of dementia. And while rare, individuals in their 30s and 40s can also develop dementia. So the myth that it's an old person's disease is untrue. And unfortunately, dementia is not preventable or curable. Currently, though, around the world, there are research studies looking into the causes of various types of dementia. But because the exact cause is still unknown, we do not yet know how to prevent it. Research does indicate that there are a number of risk factors. We mentioned age as being one of them, and yes, genetics to a very small degree. But there are other risk factors that researchers are looking at that could put people at higher risk of developing dementia, such as diabetes and hypertension, obesity, poor nutrition, smoking, and social isolation, and other factors. So this is why we tend to speak about risk reduction as opposed to prevention. There are also a number of protective factors that may help to reduce the risk of developing dementia as we age, and these do include physical activity, cognitive and social activity, education, good sleep hygiene, and protecting the head against trauma. Again, though, these factors are protective, they're not preventative. Now, I know there are many claims out there about certain foods or supplements or natural health products that can prevent dementia or reverse the damage caused by dementia. However, at this point, there is no conclusive evidence from research to support these claims. Dementia also does not mean that the person will no longer have a meaningful life. You may have seen a Jim Mann's story on our website. If not, I'd highly encourage you to go and watch the Jim story video. You can Google Jim story along with the word dementia, and you'll see it'll come up linked to dementia-friendly communities. Jim and many others contribute in a meaningful way to their family and communities after a diagnosis of dementia. People living with dementia have served on both the provincial and national Alzheimer's Society boards of directors, have worked with us as passionate advocates for a dementia strategy in British Columbia, and they have served as honorees for our annual Walk for Alzheimer's, or have spoken candidly to their own communities about living with dementia as a way of battling stigma. Dementia does not mean that the person with dementia will become aggressive. While some people with dementia do react or respond to triggers in a way that may seem aggressive, it's important to acknowledge that not everyone with dementia becomes violent. The more we can learn about the triggers of responsive or reactive behaviors and how to adjust our own responses, the more likely our interactions will be more positive in nature. And we discuss this in more in-depth in our Understanding Behaviors webinar, and we have a recorded version of that on our website. And lastly, dementia does not mean that the person with dementia can no longer understand what is going on around them. There are two language areas in the brain, one responsible for language in and one for language out. Not everyone with dementia experiences deficits in both areas, so they may be able to understand what is being said around them and about them, even if they have difficulty producing a response. This is also covered in more detail in our Understanding Communication webinar. Again, you can find that in the recorded section on our website. But the main message is that it is important not to talk about a person with dementia in front of them like they are not there. You need to include them in conversations as much as possible. As we already covered in the true or false about dementia, there is unfortunately currently no cure for Alzheimer's disease and other dementias, nor is there a treatment that will stop the progression. But there are several medications available to treat some of the symptoms of Alzheimer's disease and other dementias, like memory decline, changes in language, thinking abilities, motor skills, and anxiety levels. The first type of medications are called cholinesterase inhibitors, and they work by improving the ability of impaired nerve endings to transmit messages from one nerve cell to another. Now, there are currently 3 types of cholinesterase inhibitors available in Canada. The generic versions are covered under BC Pharmacare. They're generally prescribed to treat symptoms in people with mild to moderate Alzheimer's disease, but they're also sometimes prescribed for other types of dementia. These medications are donepezil, the generic is Aricept, and this one actually has been approved for people with severe Alzheimer's disease as well. Rivastigmine, generic is Exelon, galantamine, Reminol is the generic version. The other type of drug available is an NMDA receptor antagonist called memantine. Now, this drug has been approved for individuals with moderate to severe Alzheimer's disease, but it is not covered by pharmacare. On June the 7th, 2021, the FDA approved the first new drug for Alzheimer's disease in 18 years, called aducanumab. It is currently not yet approved by Health Canada. Now, we haven't gone into too much detail about these medications, but if medication is something you would like to learn more about, I do encourage you to speak with your doctor to see if they would be suitable for your situation. I also want to note that while these medications work great for some people, they may not work for others, and they won't work forever. Eventually, unfortunately, nerve endings degenerate and the drugs are no longer effective. However, there is a great amount of research being done to find more treatments, and eventually, we are very hopeful, a cure. And some of that great research is being done right here in British Columbia. We have included a good handout on deciding whether medications are right for you on the helpful resource document. So thank you for being so attentive. We have certainly covered a lot in this presentation. We've learned that there are several different diseases that change the brain and affect its ability to function. These diseases lead to dementia, which is a group of symptoms that includes so much more than just memory loss. Because these symptoms are the result of a brain disease, they are real physiological changes in the brain that are causing the changes you are seeing or experiencing in thinking, reasoning, communication, and behavior. And these changes will unfortunately affect our ability to navigate our day and our life. And it will impact the activities we once enjoyed, and the relationships will change. We emphasized how important it is to remember that the person living with dementia does not have control over these changes, and nor does the care partner. But what we do have control over is how we, in the role of care partner, respond to them. And then we looked at the stages where we discussed dementia being progressive, but not perfectly linear. It is possible to see symptoms arise and then fade and get mixed up over time. So for example, on Monday we may see Linda struggling to use her toothbrush. Then on Tuesday morning, Linda confidently gets ready for the day with no support at all, and it almost seems like her dementia has disappeared. And then finally we looked at medications. Again, a lot of information to take in, but what we really want you to know is that we are here to help you, and you are not alone. In conclusion, if you have questions about information you've heard here, or any other questions about living with dementia, or are interested in our programs, please don't hesitate to call our First Link Dementia Helpline. English services are available Monday to Friday from 9 a.m. to 8 p.m. at 1-800-936-6033. Services are also available Monday to Friday from 9 a.m. to 4 p.m. in Punjabi, Cantonese, and Mandarin. On behalf of the entire presentation team, thank you for tuning in, and goodbye.